And then we have collaborative practice agreements. So in 48 states, pharmacists can participate in collaborative practice agreements with supervising physicians. Oklahoma and Delaware are the only two that don't allow collaborative practice agreements with pharmacists. And interpreting results of tests is something that we're seeing, because it's one thing to order the test and it's one thing to administer the test, but once you get the results, then what is the pharmacist to do with those results? So in some states, the collaborative practice agreement has to be very specific that they can. But so we have some examples here of various state laws and regulations where it's very specific that the pharmacist is allowed to interpret the results of the test. So make the diagnosis once they get the test results back. And these test results, even though, we've been talking a lot about COVID, they don't necessarily have to be about COVID. They can be about blood pressure or cholesterol levels or any chronic condition that's ongoing, diabetes, that the physician and the pharmacist have collaborated on to address on behalf of the patient. So again, we're working really hard to make sure that patients can get the care that they need as easily as they possibly can get it. And, a logical place to do that is the pharmacy. I've read studies that have been conducted that if pharmacists are involved in collaborative practice agreements and treating these chronic ongoing conditions on behalf of patients, that medication adherence goes up quite significantly. And so we're just seeing a healthier population when we integrate pharmacists into that care team and work together with the physicians to make sure that patients are getting the care that they need.